chimeric antigen receptor T cells, or CAR T cells, have shown a dramatic efficacy, as we all know, in treating refractory aggressive B-cell lymphomas, DLBCL, and has already been approved by the EMA here in Europe for axi-cel and tisa-cel, and new therapies are coming every month, basically. But persistent cytopenia is a frequently observed complication after this therapy, including profound and prolonged neutropenia in approximately 2/3 of the patients, which may subsequently further increase the risk for infection. And to date, no data really exist on the value of hematopoietic stem cell boosts for persistent cytopenia. There are only some small case series, but we try to evaluate this in a systematic fashion using a multi-center cohort of the German Lymphoma Alliance. And we present here at the EBMT the first results for patients who received stem cell boost between 2018 and 2021 for persistent cytopenia. And they received either axi-cel or tisa-cel. And this first analysis included 15 patients who received either axi-cel, these were 9 patients, or tisa-cel, 6 patients, and most of the patients had DLBCL. The median age was 61 years, and most patients, as expected, had a low ECOG performance status in accordance with the trials to be that were published for the approval of these therapies. And the median time between the CAR T infusion and the stem cell boost was about 1 month. And one patient also received an allogeneic stem cell boost from a matched-related donor after having received an allogeneic stem cell transplantation before CAR T cell therapy. And the median number of the infused cells was about 4 million per kilogram body weight. And we found that the median time to neutrophil engraftment was 5 days, which was quite short and which is quite a promising result. And the early application of a stem cell boost within the first 2 months was correlated with sustainable blood counts and seemed to be associated with better outcome overall. And in total, only 8 patients died, and there were 2 treatment-related deaths due to sepsis. Both patients both patients who died of sepsis had grade 4 neutropenia for more than 2 months, and this is a signal that we need to be aware of the duration of the neutropenia that we identify. If we have the feeling that the neutropenia lasts too long, we should maybe consider a stem cell boost. The overall median follow-up of these CAR T infusion patients was 15 months, and the median overall survival was 20 months. And in conclusion, this is the first multi-center trial on stem cell boost for persistent cytopenia, and it demonstrates that these stem cell boosts generally result in a prompt resolution of cytopenia and is safe. And this provides evidence that the prolonged cytopenia after CAR T is due to dysfunction of hematopoietic stem or progenitor cells rather than to immunological effects. And these stem cell boosts should be considered for persistent cytopenia after CAR T therapy, if it's available, of course.